7 Dangerous Afternoon Diabetes Signs You Should Know. Most people associate diabetes symptoms with fasting, morning routines, or nighttime blood sugar crashes. But what happens in the afternoon could be just as dangerous. In fact, some of the most overlooked warning signs of unstable glucose levels appear right after lunch, when your body is supposed to feel calm and energized. If you find yourself feeling drained, foggy, or unusually irritable during the afternoon hours, your blood sugar might be trying to tell you something important, and ignoring it could be a costly mistake. In this video, you'll discover 7 specific signs that your blood sugar may be out of control in the afternoon, even if your levels looked normal earlier in the day. These symptoms can appear even if you eat relatively healthy meals, because your body's ability to handle glucose actually changes throughout the day. Understanding how your blood sugar behaves after lunch can help you avoid dangerous highs and lows, prevent long-term damage, and feel more in control. And if you stick with me until the end, I'll share one simple habit you can do after lunch to help stabilize your glucose naturally. Number 7. Increased thirst or frequent urination later in the day. One of the most overlooked yet serious afternoon warning signs of unstable blood sugar is an unusual increase in thirst or a noticeable need to urinate more often. If you find yourself reaching for water repeatedly in the late afternoon, even if you've stayed hydrated throughout the day, your body might be trying to flush out excess glucose. High blood sugar makes your kidneys work overtime to filter and eliminate the sugar through urine. That process pulls water from your tissues, which is why you feel thirsty and why you end up in the bathroom more than usual. This isn't just a harmless inconvenience. It's a sign your body is under stress and struggling to maintain balance. What makes this especially concerning is that these symptoms often show up hours after a blood sugar spike has already happened, especially after lunch. You might not even realize what triggered it. A carb-heavy meal, skipping fiber, or not enough protein could all be the cause. The key issue here is that blood glucose levels don't always stay flat after you eat. They can rise slowly, peak several hours later, and then start affecting your system in the afternoon. If this pattern is happening daily, it's not just annoying, it's a red flag. Your blood sugar may be spiking more than you think, and if left unaddressed, it could lead to long-term complications. Noticing these changes is the first step to taking back control. Number 6. Difficulty concentrating or brain fog. If you often find yourself mentally hitting a wall in the afternoon, struggling to focus, forgetting things you just read, or feeling like your mind is wrapped in fog, your blood sugar might be to blame. This kind of mental slowdown, often referred to as brain fog, is a common yet under-recognized sign of glucose imbalance after meals. When blood sugar rises too high and then drops too quickly, the brain doesn't receive the steady supply of energy it needs. The result? You feel cloudy, sluggish, and less sharp than you did just a few hours earlier. These aren't just symptoms of fatigue, they're metabolic warnings. What's particularly tricky about this symptom is that many people attribute it to age, lack of sleep, or a stressful day. But in reality, it could be a direct consequence of your lunch. A meal high in refined carbs and low in fiber or healthy fats can send your glucose on a roller coaster, and your brain feels every dip. Some people experience this drop around 2 to 4 p.m., right when they need to stay productive. If you regularly feel like you need caffeine or a nap to power through the afternoon, it might be time to look at your blood sugar, not just your schedule. Fixing your glucose curve could sharpen your mind more than any cup of coffee. Number 5. Lightheadedness or dizziness. Feeling lightheaded or dizzy in the afternoon, especially after meals or when standing up, can be a troubling sign that your blood sugar levels aren't staying stable. This often happens when your body experiences a drop in glucose after a post-lunch spike, a condition known as reactive hypoglycemia. It's more common than most people think, and it can feel like your body is suddenly drained of energy. You may feel unsteady on your feet, like the room is spinning slightly, or as if you need to sit down and regain your balance. These symptoms are your body's way of warning you that it's struggling to keep glucose within a healthy range. The danger with this kind of dizziness is that it can catch you off guard, at work, in the kitchen, or even while driving. Many people don't connect these episodes to their blood sugar because they occur hours after eating, not immediately after. But that delay is exactly what makes this so sneaky. If you're eating meals that cause rapid glucose spikes without enough fiber or protein to slow digestion, your body might overcompensate with too much insulin, driving your blood sugar down too far. Recognizing this pattern can help you make simple adjustments, like adding more protein or lowering your carb intake at lunch. That could make your afternoons much safer and more stable. Number 4. Blurry vision or eye strain. Blurry vision in the afternoon is more than just a sign that you've been staring at a screen too long. It could be your blood sugar trying to get your attention. When glucose levels rise after a meal, especially if they stay elevated, the excess sugar in your bloodstream draws fluid into the lenses of your eyes. This fluid shift changes their shape, making it harder for your eyes to focus. You might notice things like difficulty reading, seeing halos around lights, or needing to squint even with your glasses on. These visual changes are often temporary, but if they happen repeatedly in the afternoon, they may point to post-meal blood sugar spikes. What's important to understand is that your eyes are incredibly sensitive to changes in blood glucose. That's why blurry vision is often one of the earliest signs of diabetes, and one of the easiest to dismiss. Many people experience these changes after lunch, when meals that are high in carbs and low in fiber can cause glucose to surge. If you find that your eyesight feels sharper in the morning and fades as the day goes on, especially after eating, it's time to pay closer attention. Keeping your blood sugar steady throughout the day not only protects your long-term vision, but also helps you stay clear-headed and confident in daily tasks. Number 3. Sugar or carb cravings mid-afternoon. If you find yourself reaching for a cookie, chocolate, or that second cup of coffee in the middle of the afternoon, it may not be a lack of willpower. It could be your blood sugar crashing. These intense sugar or carb cravings are often a response to what's known as reactive hypoglycemia, where your glucose levels drop too quickly after a sharp rise, usually from a high-carb lunch. Your body senses this dip and sends urgent signals to the brain to get energy fast, and the fastest source is sugar. That craving is your body trying to correct the imbalance, but the problem is feeding it with more sugar only continues the roller coaster. This cycle of spike crash craving can become a daily habit without people even realizing that it's blood sugar related. Many fall into the trap of thinking they just need a snack to get through the afternoon, but what they really need is more balance at lunch and fewer refined carbs. Including more fiber, protein, and healthy fats in your midday meal can prevent that crash from happening in the first place. If you feel like you're fighting cravings every afternoon, it's time to look at your glucose response instead of blaming your appetite. When blood sugar is stable, those cravings often disappear on their own. Number 2. Irritability or sudden mood swings. Mood swings in the afternoon, like feeling irritable, anxious, or emotionally reactive without a clear reason, can be a powerful sign that your blood sugar is on a roller coaster. When glucose levels spike and then fall too quickly, the brain feels the impact. This fluctuation disrupts neurotransmitters like serotonin and dopamine, which play a big role in emotional regulation. As a result, you might snap at small things, feel overwhelmed by minor stress, or notice that you're simply not yourself for a couple of hours. These changes can be subtle or dramatic, but they're often written off as stress or fatigue when blood sugar may actually be the hidden cause. What's tricky is that emotional changes don't show up on a glucose meter, so people rarely connect the dots. But these afternoon mood shifts often occur shortly after poorly balanced meals, especially lunches that are high in white carbs and sugars without enough protein or fiber to slow digestion. When the brain is deprived of steady fuel, emotional stability takes a hit. If you find your patience running thin every day at the same time, or you crash emotionally after eating, it's worth paying closer attention to how your meals affect your mood. Stable blood sugar supports stable emotions, and recognizing that link is a major step toward feeling better mentally and physically. Number 1. Extreme sleepiness or sudden fatigue after eating. That overwhelming wave of exhaustion that hits you after lunch isn't just getting older or a busy day catching up with you. It could be a sign of poor blood sugar control. When you eat a meal that's high in refined carbs or sugar, your blood glucose can spike rapidly, prompting your body to release a surge of insulin. Sometimes, your body responds too strongly, driving glucose levels down too fast. This sudden drop leaves you feeling drained, heavy-eyed, and in desperate need of a nap. It's a blood sugar crash, and it's one of the most common, yet underestimated, afternoon warning signs for people with diabetes or prediabetes. This type of fatigue is different from normal tiredness. It can come on quickly and feel almost impossible to push through. You may find yourself yawning nonstop, losing focus, or even struggling to keep your eyes open in meetings or conversations. If this happens often, especially after meals, it's a strong indicator that your body is not processing glucose efficiently. The good news is, you can often reduce this crash by changing what you eat at lunch. Meals that include fiber, protein, and healthy fats digest more slowly and keep your energy steady. Paying attention to this sleepy signal could be the key to reclaiming your afternoons and your blood sugar control. These afternoon symptoms are more than just minor annoyances. They can be serious indicators that your blood sugar is out of balance, even if you're taking your medications or following what seems like a healthy diet. The truth is, insulin sensitivity naturally decreases as the day goes on. That means your body isn't as efficient at handling glucose in the afternoon as it is in the morning. As a result, lunch becomes one of the most important meals of the day when it comes to managing diabetes. Recognizing these signs early gives you the chance to adjust course before things get worse. And that small shift in awareness can protect your long-term health in a big way. And as promised, here's one simple habit you can start today to help stabilize your glucose naturally after lunch. Take a 10-minute walk. That's it. Just getting your body moving right after you eat helps your muscles absorb glucose more effectively and prevents those big spikes and crashes we talked about. It doesn't have to be intense. A light stroll around the block, up and down the hallway, or even in place can make a real difference. It's one of the most underrated tools in your blood sugar toolkit, and it costs nothing but a little intention. Have you ever felt any of these symptoms in the afternoon? Let me know in the comments. I'd really love to hear about your experience. And if this video helped you in any way, don't forget to like it, share it with someone you care about, and subscribe to the channel. Always consult your healthcare provider before making changes to your treatment or lifestyle, especially if you have diabetes or any chronic condition. You never know who's out there struggling with these exact signs and just needs the right information to take control again.